Hello everyone, I'm Brittany De Palma.
And I'm Paige C Britney D.
And welcome to episode 1 of our nursing podcast, Couple of Scrubs.
So today we're going to talk about how biases may affect our nursing practice. First off, we're going to talk about our case scenario, and then afterwards we're going to analyze the situation and see how our personal biases may have affected the care we gave our client. So, during my shadow shift in labor and delivery, client X, a Caucasian woman in her early 20s, came in with her partner. After our initial conversation, I was able to gather that her primary source of income was through prostitution. She also disclosed to me that her pregnancy was accidental. However, her and her partner decided they wanted to keep the baby. The woman was in her third trimester of pregnancy, and this was her third and final checkup on week 32 prior to her estimated due date.
She revealed to the nurse and I that she has genital herpes and was concerned this would affect birthing her child. Despite this divulgence of information, she did not want her significant other to know, as she was embarrassed and felt she would be criticized. Since genital herpes is a treatable condition, myself and the nurse were required to keep this information under wraps and legally did not have the permission to disclose it to the woman's partner. This was an extremely tough position to be in, as although genital herpes is treatable, it is lifelong once you've contracted this disease. I personally felt that the woman's partner had a right to know, as this was something that could potentially affect his health, knowing the two individuals had unprotected sex and may do so again in the future. As well, this was concerning as their baby has a potential to contract the infection, which could lead to potential future health concerns. Okay, so Paige, how do you find that your biases arise within practice?
Well, by being situated in a culture where monogamy in marriage is a norm when choosing to start a family, I was biased towards my client who was carrying out an accidental pregnancy with her partner.
Okay, and were the two married at the time?
No, they were not married, which emphasized my biases to an even greater extent. And as well, my bias towards prostitution is constituted in me by living in a society where prostitution or regularly taking part in sexual activity with a number of partners is frowned upon.
Next, Paige and I are going to discuss the impact the biases had within our practice.
So, confidentiality may be impacted due to the belief that this information should not be withheld from her significant other. Maltreatment of the patient by myself or the rest of my healthcare team could happen due to her withholding this information from her partner. And moral distress may arise in myself or my healthcare team due to this scenario, and this can allocate to burnout and lower job satisfaction.
So, as stated by the BCCNP Standards of Practice, ethical or moral distress stems from nurses' inability to act in correspondence with their moral beliefs. Nurses may feel that they know the right course of action, but both personal and systemic limitations may conflict with what is morally just. Ethical distress can lead to negative outcomes such as anger, frustration, and guilt, yet can also stimulate one's drive to advocate for themselves, focus on self-betterment, and reflect on lived experiences. Next, we're going to explore biases in general and how they relate to two course concepts in our relational practice class.
So, biases are a natural part of being human, in which we are consciously assigning judgments, whether they be good or bad, with situations that we encounter. Biases impact all of us, though those of minority groups are especially vulnerable to experience biases or discrimination. Unconscious biases can also be referred to as implicit biases, which can provoke unintentional discriminatory behaviors, which can contribute to disparities that are evident in the healthcare setting. Biases may affect patient assessments, medical diagnoses, the quality of care a patient receives, the nurse-patient relationship, treatment decisions, and even the discharging process. Seeing as she was a prostitute, I initially suspected that she may have had an STI prior to learning that she had herpes. Also, the impression I had gathered from the situation was that client X was irresponsible as both a mother and a partner due to her choice to fulfill prostitution, in which is a risky profession, as well as the failure to disclose this information to her partner. In addition, she neglected to use protection while engaging in sexual activity, knowing that she had herpes, which ultimately put her partner at risk for developing this infection. Thus, client X mistakenly became pregnant as a result of the failure to use contraception. Due to her choice of withholding information from her boyfriend, I also made the assumption that she was a dishonest and untrustful partner. I caught myself also feeling worried about the baby's well-being born into the environment that her parents live in. This made me question whether or not client X was fit to be a good mother, given that she had unprotected sex while also knowing that she had a communicable disease that could be passed on to her partner and her child if intercourse resulted in a pregnancy.
Marginalization is a process of treating a person or group based on their identities, associations, experiences, and environment. As a result of marginalization, people and groups may have challenges accessing power, political and social resources, on top of being vulnerable to biased treatment due to their position in society. The impacts of my biases led to marginalization of the care provided to my client. As a result of carrying out a career in prostitution, I may have treated her as less than or based my actions towards her off of discriminatory judgment. Recognizing marginalization is crucial to healthcare practice, as it is only once we acknowledge how it affects our practice and our patients that we can intervene to improve health outcomes. By appreciating the relationship between marginalization and social determinants of health, we can gain a better understanding of health inequities that are present in healthcare delivery and disparities that exist among vulnerable population groups. Stereotypes are perceptions we may possess towards others in which we develop from our upbringing, cultural background and norms, values, and other factors. These stereotypes we possess can closely relate to the biases that arise in practice and how these biases essentially influence our practice. As discussed, we concluded that client X was most likely irresponsible, promiscuous, and knowing her occupation and history, this led to stipulation of the presence of a potential STI. Stereotyping is an imperative concept in which nurses must be able to recognize and mitigate when in practice. With the greater knowledge base surrounding stereotyping, nurses can therefore develop effective strategies in order to be less judgmental and more open-minded to the challenges we may face within the healthcare profession. Okay, Paige, could you describe some interventions that could be used to mitigate your biases?
Yeah, one I really like to practice is mindfulness.
So could you elaborate on what that means?
Yeah, mindfulness is when you're consciously making an effort to de-escalate the negative thoughts and feelings by being mindful and grounding myself in the here and now. In doing so, I can act more compassionate and provide more therapeutic care when I'm dealing with my clients.
It's important we learn how to clear the mind in order to be fully present, as well as focusing our thoughts towards being free of judgment.
Exactly. This allows us to take time to reflect on actions and to be more aware of our biases without impulsively integrating them into our practice. Ultimately, these strategies have been incorporated to minimize stress, poor outcomes, and to create a more positive conversation between the healthcare team and our patient. An important strategy to highlight for practicing mindfulness is the acronym STOP. This can help me to foster a healthier engagement with my patients. So first of all, you stop to take a minute and pause. Next, you take a moment to focus and slow your breathing. Lastly, observe the thoughts, biases, and judgments you possess. And after the steps above have been completed, you're now able to proceed care with a grounded mindset. I can also engage in the process of replacing the stereotypes that I'm aware of holding. This can be through reflecting on negative responses to particular population groups, recognizing the stereotypical responses that I carry out, consider the reasons for those reactions, while also committing myself to respond more compassionately hereafter. By thoughtfully reflecting on the significance of my reactions, feelings, and whether they impact the nature of my nurse-client relationship, I'm able to recognize stereotypes and prevent myself from acting on unrecognized biases in the future.
One principle that may be affected in this situation is laid out by the CNA Code of Ethics. This is maintaining privacy and confidentiality. As stated in the CNA Code of Ethics, nurses recognize the importance of privacy and confidentiality and safeguard personal, family, and community information obtained in the context of a professional relationship. Oftentimes, as professionals, we have difficulty deciding the best course of action in regard to confidentiality, and it can be challenging to determine when confidentiality is to be breached or not. A standard outlined in the BCCNP Standards of Practice is identifying the effect of one's own values, beliefs, and experiences in carrying out clinical activities. As well, it recognizes potential conflicts and takes action to prevent or resolve them. In many cases, our own values, beliefs, and experiences directly influence the care we provide and how we are to determine the best course of action. However, this can create challenges as our beliefs, values, and experiences may conflict with others, as well as with what is morally right. How would failure to address your biases influence both the standard and principle I previously discussed?
By failing to address the patient's right to privacy and confidentiality, I would have breached my ethical responsibility to my patient. In doing so, privacy laws and policies, which are put into place to protect persons receiving care, may be breached. As a nurse, I'm obligated to uphold and base my actions off of the values outlined in the CNA's Code of Practice in order to protect the public. Failure to maintain confidentiality of my patient's situation could result in lack of trust within the relationship that I have with my client. If she loses trust in me as her healthcare provider, she may choose not to disclose pertinent information to the healthcare team in the future, which will in turn be potentially harmful to the patient. Additionally, I may be reprimanded professionally due to not abiding by my responsibilities as a nurse. When the care we provide is influenced by our own values, beliefs, and experiences explicitly without recognizing those of our patient, this often creates difficulty in providing the paramount patient-centered care highly discussed in nursing school. This can ultimately lead to decreased patient satisfaction and cause them to feel as if their values, beliefs, and experiences are unimportant. Consequences of failing to uphold this standard could create poor healthcare experiences for the client and further hesitation to seek healthcare in the future.
Thanks everyone for tuning in. See you next time.